in your brain, there's a balance, like a board on a fulcrum, and that balance represents or is a metaphor for how we process pleasure and pain, because what neuroscience has shown is that pleasure and pain are processed in the very same part of the brain, which is in and of itself, pretty interesting. And that pleasure and pain work like opposite sides of a balance. When we do something pleasurable, we tip to the side of pleasure. Dopamine is released in our brain's reward pathway. Dopamine is a chemical our brain makes. It's a neurotransmitter, and it's intimately involved in the experience of reward, pleasure, and motivation. But the overriding rule governing this balance is that it wants to remain level or preserve homeostasis. And any deviation from neutrality is essentially the definition of stress. And once we deviate from neutrality, our brains will work hard to restore homeostasis. So when we release dopamine in the reward pathway, our brain will downregulate our own dopamine production and transmission, involute our dopamine receptors as a way to bring things back to balance. But it does that by overshooting. And in fact, decreasing dopamine levels to below baseline levels, or I imagine this as these gremlins hopping on the pain side of the balance to bring it level again, but they stay on until it's tipped an equal and opposite amount to the side of pain before going back to baseline. And that's how it works. There's a price for every pleasure, and the cost is some kind of period of pain. It can be physiologic, like the hangover, after we've been drinking heavily, but it's very often more of a subtle cumulative effect of psychological symptoms like irritability, anxiety, depression, intrusive thoughts of wanting our drug. The other rule governing this balance is that with repeated exposure to highly reinforcing drugs, that initial pleasurable response gets weaker and shorter, but the after response gets stronger and longer. In other words, the balance remembers. And those gremlins, yeah, it's evil. It's evil in a way. We can talk about how it's really kind of makes total sense. Okay. But the gremlins, once created, they don't disappear. They're like waiting in the wings of the base of that balance, eager to hop on again. So with a secondary exposure, a third or 100th exposure, they're now, boom, right away. And then that after response gets stronger and longer over time. So that ultimately, if we're bombarding our reward pathway with these dopamine releasing drugs and behaviors, we accumulate so many gremlins on the pain side of the balance that they were essentially walking around with the balance tilted to the side of pain. They're camped out there. And now we need to use our drug just to get out of the pain state. Now we need to use our drug to feel normal. We need more and more potent forms. We're essentially at war with our gremlins. And our focus is really then narrowed, and other things are no longer enjoyable. And this physiologic drive, once our balance is tipped here, the drive to want to get that drug to restore homeostasis is overwhelming. It's very, very difficult to resist that pull, and we're all vulnerable to it. And that's the physiology that essentially makes people relapse even weeks or months after, they've abstained from their drug, because if they're still walking around with a balance tilted to the side of pain, it's like every day is a battle.
I got Jesus in my mind. In this world I live, Lord, I'm on my way to